Hello, I'm Barbara Serra. You're watching Al Jazeera and the World Health Organization news conference in Geneva, the regular one, where they have just announced that the coronavirus crisis has gone from an epidemic to a pandemic. We heard from the Director General, Tedros Adhanom Ghebreyesus, about it just about 20 minutes ago, if that. So the coronavirus crisis has now been defined as a pandemic. At the news conference, they're now taking questions via video link and internet link with various journalists. Let's dip in again to listen to what they're saying.
Response capacities towards the potential isolation and treatment of cases. I think in other countries, in Nigeria, for example, within 48 hours of the first case, Nigeria had established a 100-bed isolation unit. So, but I think the development of the clinical support and isolation services is uneven. And while it may be present at national level, one of the things we found during the Ebola outbreak was that reproducing preparedness at sub-national level, at district level, is another challenge that we need to address. So our work now is moving the preparedness activities from the national level down to the district level in all countries in Africa. But I think we are pleased with the development so far. We believe there may be an element of underdiagnosis in some countries, and we're chasing that and trying to activate surveillance on the whole continent.
Mm-hmm. Thank you. And to add to that, countries in Africa have been our focus, and we're very much encouraged by the progress we have made through our regional office in Afro and also the Africa CDC. As you know, our major concern was, the introduction of this virus in countries with weaker health systems, and our focus from the beginning was where our concern is. So there is progress, but at the same time we will continue to build on what we have been doing, and Africa will continue to be our focus, and especially in building capacity and improving the overall preparedness. So Murakoze Chane for your question, Christophe.
Can I add one more thing? Is that in addition to what we're trying to do in terms of providing guidance and supports and kits and building on existing systems that are there, there's a training element that we've been working on. And given the demands on everybody's time and the demands on people's ability or inability to come face to face, we're trying to look at innovative ways in which we can translate some of our training materials through online courses and through interactive sessions so that we can speak clinician to clinician, IPC specialist to IPC specialist, to provide that one-on-one support where that is needed. And so that will continue as this situation evolves.
Thank you very much. Catherine, here in the room, please.
Yes, Catherine Fiancon-Bokonga, France 24. I'd like to have your reaction about what's happening in Italy. They have a shortage of equipment, of supply. They need more health workers. How do you want solidarity to be expressed? Are there some Chinese health workers that are going to go to Italy, or health workers from countries that are not affected? Is there a plan for that? And is WHO coordinating the platform for these kind of support and help? Thank you.
We've been obviously working through our regional office, and our regional director, Hans Kluge, has been, I think, twice in Italy in the last couple of weeks, working with them. We have had a team on the ground for the last 2 weeks in Italy, in the epicenter of the outbreak. The DG has deployed Assistant Director General Ranieri to Italy and has met with senior officials in the Italian government over the last 24 hours to discuss just those issues around how do we provide further strategic support to the government of Italy, particularly in managing the heavy caseloads that they have. I know the Italian government are reaching out to their partners in the European Union as well, and we hope to see that solidarity within the Union to support Italy. China have definitely offered support, and we're working in a tripartite with China to look at the supply, particularly of things like PPE, ventilators and other issues. But obviously that's a work in progress. But again, we thank China for its solidarity in trying to prioritise supply chains to a country like Italy and to countries like Iran. They clearly are willing to discuss with WHO and coordinate with WHO where the best targets are for the surplus equipment they may have. And, you know, China has been through it, and there's not that much surplus, but they are willing, very, very willing to work with us to see where that's most needed, and we're grateful for that. I don't know, Tedros, you've had some high-level discussions with various parties, so you may wish to supplement.
And we've been watching the World Health Organization news conference from Geneva, where they have just announced that the coronavirus crisis has been changed from an epidemic to a pandemic. Let's speak to Dr. Eric Toner, who's a senior scientist at the Johns Hopkins Center for Health Security. He joins us now via Skype from the U.S. city of Baltimore. Dr. Toner, thank you so much for joining us. You've actually been saying that this is a pandemic for some time now. So what's your reaction to this announcement from the WHO? Why do you think they're making it now?
Well, I'm very glad that they're making this announcement. I think it's been obvious, as you said, to many of us that it has been a pandemic for several weeks. And I think this removes any ambiguity about the global situation. This disease is spreading around the world. It will continue to spread around the world. Every country will be affected. And so I think this clears up any confusion about that.
Could you clarify for us, please, what the actual difference is between an epidemic and a pandemic? So what coronavirus has been so far and what it's become now, according to the WHO?
Well, there's no universally agreed upon definition of a pandemic. Pandemic literally means all people. And but commonly within public health, we've talked about a pandemic meaning an infectious disease that's spreading person to person on multiple continents. So that's been the case for several weeks. WHO seems to also consider it to mean that all people are at risk of the disease, and I think that's fair, and I think that is now obviously the case with this disease.
We heard from Dr. Tedros, the Director General of the WHO. He said he was deeply concerned both by the alarming levels of the spread and severity of the coronavirus, but also what he said, the alarming levels of inaction. What do you think the WHO's actual message is to governments around the world in declaring the coronavirus crisis a pandemic?
I think they're saying to all governments, you really need to get ready. You really, no kidding, need to implement measures to slow the spread within your own country. And so some countries have been denying that their country's at risk or saying that they have no cases when that's probably not actually true. So I think WHO is saying to them, really, you have to get ready.
Explain to us what that would mean, though, for countries that are seeing a rise in cases, but not situations as alarming as perhaps Iran or Italy.
Well, you have to understand the nature of exponential growth. So this disease seems to have a 6 or 7 day doubling time. That means twice as many cases each week. So most of the people who are sick have a mild illness, much like influenza. And they're not going to come to the attention of public health authorities. It's not until you get hundreds of cases that there's any chance that a country would recognize that they have cases. And it's probably not until there are thousands of cases that it really become quite obvious.
Dr. Toner, Forgive me for interrupting. I know that you have to go, and there's just a final question I want to put to you. If countries do what I guess the WHO is suggesting that they do, when do you think, or where do you think we'll see the peak of the infections around the world? When do you think that some sort of normality might return?
Well, I think there'll be a different peak in every country. So China has already seen its peak. And looks like maybe South Korea has as well. So it will probably be an outbreak within each country that lasts for a couple months, and then it'll move on. But yet it may come back again later. This will continue to spread until most people eventually are infected.
Dr. Eric Toner, Senior Scientist at the Johns Hopkins Center for Health Security. Sir, thank you so much for having shared your views and experience with us. Thank you.
You're very welcome.
Also, this announcement by the WHO, as the coronavirus, of course, continues to fuel fears that Europe could slip into a recession. Several countries are resorting to sweeping measures to fight the epidemic. Let's talk now to Niamh Barker, who joins us in the studio. I mean, it's interesting how there's almost two ways of talking about it. There's the health scare, and then every country, obviously, understandably, I guess, worried about the economy because of the impact that a coronavirus epidemic and pandemic could have on their economies. So how do you think that this message by the WHO will be welcomed by a lot of governments?
I think what the clear message is that all countries need to see this as being clearly much, much more than a health issue. It goes beyond that. It's a political issue. It's an economic issue. There isn't a single country here in the Europe that is not going to be in some way, shape or form affected by that. That is the clear distinction that the WHO have made by calling this a pandemic over an epidemic, and that requires some aggressive preparedness. What we've seen in the last couple of days is the EU 27 come together to try and coordinate efforts to come up with a coronavirus task force with whatever strategy that task force may now work out. It's really down to them to try and roll that out in the coming days. Individual countries are taking their own strategies. Here in the United Kingdom, there isn't at the moment any kind of strategy to reduce gatherings of people or to check people's temperatures at airports and things like that. The British approach is very much based upon science and against mitigating the problem further down the line. But there is a feeling now that the WHO have called this a pandemic that perhaps governments need to start talking. Because
they were very clear. I mean, Dr. Tedros, the Director General, said, you know, he obviously mentioned the alarm of the spread and the health repercussions, but the alarming levels of inaction by various governments. And even now, we see governments that don't have that many cases kind of tinker around the edges as opposed to address it head on. Yeah, well, according to the WHO, there are 81 countries in the world that currently don't have any cases of the coronavirus. And that doesn't mean that they should sit back on their laurels and hope for the best. The message very much is that if there are no cases of the coronavirus or levels are very low, the countries should continue with what's called the containment stage, to try and reduce the possible spread of the virus. The next stage is the delay stage to avoid putting health services in different countries under strain. And once that is no longer applicable, we're talking about the research and mitigation stage. Hopefully, by that point, we'll be talking about vaccinations and other ways of treating the virus, wherever it may go next. Niamh Barker with the latest on that. Thank you. Let's go live now to Natasha Butler, who is in Paris for us. Natasha, it may be, I guess, a little bit early to expect some kind of reaction from the French government to this announcement by the WHO. But generally speaking, how have they been handling, or how do they plan to handle an expanding crisis there in France?
Well, there are already over 1,700 diagnosed cases of the coronavirus in France. More than 30 people have died. And of course, those numbers are going up all the time. And for the past few weeks, the French government has been on something of a war footing for this health crisis, national emergency, they call it. They say that the hospitals are prepared. They say that there are enough testing kits. There are enough respiratory machines, at least for the time being. But of course, each day the situation is evolving. They've already put in a raft of measures in place, restrictions in certain cluster zones. These are cluster zones where there are a high number of infected people, so perhaps travel is restricted there, people aren't able to go to work, schools are closed. They've banned many public gatherings. In fact, all gatherings inside of more than 1,000 people have been banned to try and stop the spread of this virus, because that is the French government's tactic. They say there's nothing we can do about it being here. It is amongst us and the population in France, but we need to try and stop the spread. But of course, as I said, it is at all levels of the French population. We've seen this week the French culture minister diagnosed with the coronavirus. He's at home in isolation. Other ministers are being tested to see whether perhaps they had it, because of course they came into contact with him. 5 MPs, 5 members of the French Parliament also diagnosed with the coronavirus. So it really is at all levels of society here in France.
Natasha Butler with the latest from Paris. Natasha, thank you. Of course, France's neighbour Italy has been the worst-hit country in Europe, one of the worst-hit in the world, and the government there is considering taking even tougher measures to try to contain the outbreak, as 827 people are now known to have died. Flavia Riccardo is a virologist at the Italian National Institute of Health. She says it took people in Italy a while to realise the severity of the crisis.
There was a difficulty, I think, in the early stages to really understand what this was about. Of course, in the scientific field, this had been known for a while. WHO had issued a public health emergency very early on. But this, coming to everybody had to be translated and had to be understood properly. So I think this now is something that is happening. People are starting, I think, to gain awareness, and we're really trying to push and explain why certain measures are in place. I think what we learned in Italy is that this is, unfortunately, a virus that spreads very well. It's a new virus, which means a lot of susceptible people can get sick at the same time. I think we shouldn't underestimate it. I think we should be very careful about how to move and move properly and fast with the right level of proportion. Also in Italy, clearly the situation is not the same across the country. There are different levels of action that are required. And I think it's also very important early on to get people on board, because finally this is a battle that we'll all will together. This really needs to be something which we're all fighting against in our everyday life and changing our behaviors.
Let's go live now to Kristen Salumi, who is in New York for us. So, Kristen, that announcement just under an hour ago by the WHO, it is now officially a coronavirus pandemic. What reaction from the markets there?
Yeah, the markets were already down, and that announcement sent them down even lower. The Dow has plunged to 1,200 points lower now, more than, or almost 5%. And this is true across the major stock indexes here in New York and across stock sectors. The uncertainty over the spread of the coronavirus as more people stay home and the government's lack of response here in the United States so far has investors very shaky. We've seen issues with stocks in a number of sectors, including airlines and cruise lines, perhaps some of the most hardest hit. They were down more than 7% earlier today. They continue to be lower with all of this uncertainty. Oil prices are another concern weighing on the markets here. The price war that started between Saudi Arabia and Russia impacting energy companies here. The United States was actually the largest oil producer in the world, with prices down. That could hurt shale producers who have high amounts of debt. The markets are worried about that as well. And even earlier in the day, when we heard from U.S. Treasury Secretary Steve Mnuchin, and that they were on the verge of working out an initial response to the coronavirus. They were planning to introduce something with House leadership in the next 48 hours. There were no specifics in that plan, and it did not help the markets, give them any more confidence at all. So really a down day, fueling the concerns as well. You've got major financial companies and their economists lowering their forecast for growth in the coming months. And that also has people talking about the possibility of a recession coming forward. Even though the United States has had a very strong data underneath it all. Job growth has been good. The GDP is at a record level for the last 2 years. The uncertainty going forward really has investors spooked, and that it seems to indicate a lack of confidence that White House and Congress are going to get together anytime soon with a plan.
Well, to see if that lack of confidence is justified, let's cross to the White House. And Kristen Salumi, thank you for your contribution. But let's speak to Kimberly Halkett, who is our White House correspondent. So do you think that those fears are perhaps justified? How organized has the U.S. government machine been at tackling this crisis?
Yeah, there are so many different facets working all at once in tandem. Let's start with the financial aspect. There is a lot of nervousness, concern about how this will affect the U.S. economy. That's why we know that the U.S. president at 19 GMT, he'll be holding a meeting with Wall Street executives here at the White House as they try to come up with different remedies to sort of calm some of those market jitters that Kristen was talking about. But then when you go to some of the public alarm that is occurring, we also know that there are discussions underway as many people in the United States continue to really fear for the spread of coronavirus in the United States now and in a majority of U.S. states. We know that the coronavirus task force has been weighing a number of different options in terms of containing the spread of that virus. We're not sure if this will be some sort of guidance that will be issued through executive order, but we are hearing that there will be aggressive steps taken in order to see that local communities have the tools they need to stem the or sort of counter the spread of the coronavirus. One other thing that we're hearing is that there may be soon an announcement coming from the White House in terms of some kind of disaster declaration. What that would do is free up some $40 billion in emergency funding in order to give local communities the resources they need to counter the spread of the virus.
Kimberly, perhaps this may go a little bit beyond your remit as White House correspondent, but as an observer of all things American, of course, you do live there. What do you make of the public opinion there about this virus? Do people in the States still see this as something that's affecting China, increasingly parts of Europe, or do you sense almost a fear now, perhaps creeping in the American public?
Things changed in about the last 24 to 48 hours. I would say up until then, there was kind of a normalcy bias that it can't happen here, it won't affect us. People were pretty relaxed, but that all changed kind of over the weekend, the start of early this week. That's when you started to hear ordinary folks that up till now had been brushing things off, going and stocking up, preparing, making sure that household essentials were in place, and also making sure that they had medications in place. As we're hearing more and more about the spread of this in Europe, it's inching ever closer to the United States. I think people really woke up when they heard that there was now an enforced quarantine happening in the suburbs of New York City in the area of New Rochelle. Once the National Guard was brought in, that's where people are not allowed to leave their homes. And if they do, they could be faced with an armed presence. That is really a dramatic shift in the United States. Certainly no one's using words like martial law or anything like that, but it's so very close. The public health officials using language that Americans are not familiar with. So this is what has made it real for so many Americans. And I can tell you, many are already putting in place self-imposed quarantine. They are working from home if they can, and many schools in the area across the United States taking steps to keep children at home as well. This has become very real for the average American, not just those on Wall Street.
Kimberly Halkett with the latest there from the White House. Kimberly, as always, thank you.